Hi, I'm Dr. Samuel Cooper of North Endicott Chiropractic, and I want to give you a little tour of my office. This is our waiting area, but several other things happen here. I do a workshop or a spinal care class anywhere from once to 4 times a month to teach new patients how to not undo what I do. That way you're not wasting time and money, and I'm not shoveling sand at the ocean. Many of our patients do warm-up exercises before they get adjusted so that their muscles will warm their ligaments, and their ligaments will then both adjust better and traction better. We teach many patients how to use home traction equipment. In order to stretch ligaments, you need sustained force over time, so we teach that as well. The adjusting is done in here, and this is my adjusting table. The adjusting is always mirror image. What that means is that if your head's twisted this way, I'm not going to twist it this way, I'm only going to twist it this way. If you're we're all supposed to have curves like this in the neck. If your curve is like this from looking down all day, as many people's are, I am likely to have you face down here and use the drop piece in order to put more curve into the neck and take some of the reversal out. Many of our patients have a loss of curve in the lower back. I may lift them up by the lower back with a winch on this device. And at the same time, I may support their neck where the reverse curve is and drop their head back, possibly pull it back. We may not have support here, or we might, depending on what the patient's needs are. We sometimes actually lift patients by the pelvis in order to flatten the lower back because they have too much curve in the lower back. If you've ever seen someone who looked like this, we can put them over here on the bari-lateral translation table and stretch them in the opposite direction in order to have them come out somewhere in between. Some patients, because their feet are off, maybe one arch is dropped more than the other, it can throw their pelvis off, which can throw the spine off, and it's impossible to put things into proper alignment if they don't have a stable base. So in many cases, we will cast people for orthotics, custom made. Sometimes we will use over-the-counter orthotics to help people that have financial difficulties. For many of our more difficult cases, we do traction in here. Traction is sustained force over time in order to change the shapes of ligaments. For scoliosis patients, we will often have the chair facing this way, and we will pull from side to side. We might stabilize the pelvis here, pull the lumbars this way, pull the thoracics this way, pull the head back this way. I've had the best success with scoliosis is, of course, when I catch it before the major puberty growth onset. In a case like that with a 12-year-old, he was told by an orthopedist, we'll wait until he's done growing and then put rods in his spine. But we were able to correct the alignment so that he had no scoliosis by the time the 1-year follow-up came around. And he was able to avoid that surgery. Some of his scoliosis came back because he didn't follow through with as much maintenance as he should have, but certainly not to the extent that it would have if we had not caught it then. In many cases, because there's a loss of curve in the neck, sometimes in the lower back, we'll often have the chair facing this way, and we might, for example, have the neck pulled forward where the reversal of the curve is, using a weight pulley to pull the neck forward at that level, and another weight pulley with a head harness pulling the head back. It could be up and back, straight back, down and back, and it can even be side to side. I might have the lumbars pulled towards this front post, the thoracics pulled towards the rear post, and the neck pulled forward and the head pulled back and possibly off to one side or the other. It's true three-dimensional traction. It gives us tremendous versatility to address a number of different types of problems. I think my most dramatic case of this sort was with a man who had jumped off a freight train when he was 17. He, for the next 20 years, had varying degrees of on and off pain. One morning he woke up, he could barely move. He couldn't sit or stand for more than 10 or 15 minutes before the weight of his head pressing on his discs caused him so much agony he had to lie down. And he had already been told by another chiropractor, a physiatrist, an orthopedist, and a neurosurgeon later, you need to stop thinking about conservative care. You need surgery. You have 3 herniated discs in your neck, severe degeneration. He didn't have surgery. He, last I knew, was working full-time at hard manual labor. and we were able to take some of the reversal out of his neck, put the curve back in, and get the weight off of his discs enough for him to function.